Hello, everyone, and welcome. We are so pleased to welcome Dr. Bruce Katz to the podcast today. Dr. Katz is a clinical professor of dermatology at the Icahn School of Medicine at Mount Sinai and director of the Juva Skin and Laser Center in New York. As a leading innovator of advanced laser technology and other skin rejuvenation techniques, Dr. Katz makes frequent guest appearances in media and lectures at scientific and medical symposiums worldwide. Welcome today, Dr. Katz. It's such a pleasure to have you. So the first question we'd like to ask you is, the global facial injectables market size is expected to reach USD 9.07 billion by 2028. What does this mean for aesthetic medicine providers? Are there more ways to capitalize on this growth other than simply offering injectables?
I think this estimate is quite accurate. We know that injectables keep getting more and more popular. More and more injectables are on the market. And now we even have injectables to treat cellulite. So we have injectables to relax muscles, such as the neurotoxins, injectable fillers, injectables that are also collagen stimulators, and also, very superficial skin sort of prompters that will stimulate collagen very superficially. And now an injectable CCH that is used to treat cellulite. So this market will continue to grow very rapidly.
That's amazing. And I'm in South Florida, and I know that plenty of people here would be very interested in that.
Absolutely.
Yes. So which new or emerging laser technology or treatment should providers have their eyes on, or maybe consider offering in their practice if they don't already?
There are a lot of new technologies, energy-based, as well as lasers. One energy-based device now is something called CellFX. This is a nanopulse stimulation. It's a very high-powered electric pulse, and I've been doing the studies on this, and we found that it works to treat acne, to treat benign lesions, treating warts in 1 or 2 treatments, usually resolving them. So this is really interesting. Very brand new energy source that hasn't been available previously. So I think it has a lot of potential, possibly even for treating skin cancers in the future.
Wow, that's amazing. I do know a few people myself who have already gone through the laser technology. How many treatments is that usually for, let's just say, an acne treatment?
Usually acne treatments, maybe 2 or 3 times with this technology. We know that warts often require many treatments to get rid of, and the studies we've done with CellFX have shown that it works in 1 or 2 treatments and clears the warts.
Wow.
Another technology that's really very exciting that's just come out in the last year is My Elevate. And this is a suture technique that allows us to take away the platysmal bands here in the neck and tighten the skin just using sutures and little needle sticks without creating any incisions or scarring. Another interesting technology is mSculpt Neo, a combination of high-FEM, which is high-intensity focused electromagnetic fields, and radio frequency, not only to build muscle now, but also take away fat, all non-invasively. So these are just a few of the new groundbreaking, really disruptive technologies that we see in our field.
Wow, that's pretty amazing. So for someone interested in facial rejuvenation, let's say, but hesitant to commit to surgery, which non-invasive or minimally invasive procedure delivers the best results, would you say?
Well, there are a lot of different approaches. It depends on what you want to achieve. Do you want to tighten your skin? Do you want to reduce fat non-invasively? Do you want to build muscle? And do you want to treat cellulite? We have technologies now that can address all 4 of those body contouring issues.
You practice both clinical and aesthetic dermatology. Which field has the most growth potential for new practitioners? If a dermatology student or resident were deciding between dermatologic subspecialties, what would your advice be for them?
Well, I'm biased. I've always practiced cosmetic dermatology, and I've been very involved with lasers and cosmetic surgery. So that would be my pick to recommend. But there's so many different areas in dermatology that are available.
Understandable. Of course, you might be a little biased.
Absolutely.
Your partnership with Livederm as faculty at many of our prestigious events draws quite a following. What do you think Livederm offers our attendees that other conferences do not?
Livederm is a great meeting. It's really intimate. You can learn from the pioneers in these different areas and speak to them during the meeting because, it's not too big and allows us to really network, meet with other colleagues, and really learn about the latest technologies in a very warm, great location, South Beach, and really learn about the latest developments and also see live treatments, which is really a big benefit.
Yes, definitely. Wow. And also, so February is Black History Month. Livederm has dedicated resources and programming to address dermatologic conditions that disproportionately affect or burden people with skin of color. What is your experience in this area, and how can the dermatology community lessen these disparities?
Well, I think it's very important that our practitioners learn more about treating our patients with skin of color. Sometimes it can be more complicated, particularly with laser treatments when we're treating darker skin. So it's important to learn how to treat these areas very effectively. And I think there's great potential for improving treatments that haven't been that successful in the past. So I think this is a great opportunity, particularly at Livederm, where we can learn about new treatments as well as how to optimize our treatments for our patients with skin of color.
Thank you. That's so insightful. And I also have to ask you, because this is a signature question of mine that I usually ask on podcasts, if there's one thing that you would like to be known for, whether it be in your medical profession or your personal world, what would that be?
Well, hopefully I'll be known for helping to contribute good research, new developments in laser and cosmetic dermatology, and also be known for treating my patients really well and taking great care of them.
I think you absolutely are already, so that's a great answer. And is there anything else you'd like to share with our audience today?
I would just say, make sure you get to Livederm. It's a great meeting. You should really come and meet with all of us, and you'll have a great time and have a great learning experience.
Thank you so much. It's been a pleasure talking with you, Dr. Katz. Thank you for your time.
My pleasure, Melissa. Absolutely. Take care.
Thank you.